Wanted to start us off with just a bit of a plug for some new resources that are available now on the HPSM website. We are, I think folks are really, I hope, much more prepared than we have been in past years, unfortunately, after having gone through some similar challenges over the last couple of years with the planned power outages as well as handling air quality. But wanted to just highlight a couple of links that we'll be sending out to folks after today's meeting. The first one here is really just on that main page of hpsm.org. You'll see a number of resources there, many of them really targeted towards our individual members and kind of making that plan at home. But a couple of them are links that we want to just make sure folks are aware of that may be useful to you as well. So one of those is a set of resources on kind of guidelines around medication refrigeration and handling medications that require refrigeration, as well as some guidelines for folks who are dependent on powered DME. We also have included a few links to just general planning resources, including the outage map for tracking where that's coming. And I do know that this group as a whole has done a lot for kind of that disaster preparedness in the past few years, but really just wanted to make sure that these resources are easy to access and available to folks. I will pause there for just a moment and just see if, this is an area where folks have kind of any upcoming concerns. I know some investments have been made in generators and kind of backup power planning. But really want to just kind of pause for a moment and see if this is an area of concern for facilities, or if there are more resources that you're looking to put in place for the upcoming fire season. Okay. Well, again, this one, we know, folks, this is a pretty well prepared group, but just want to again make sure that those resources are really made available to you. Next up, we did want to just do a bit of a reflection on some trends with payment before we jump into some more programmatic updates from the plan. So the first piece of this is really going back in time a little bit to what we had set out to do around PDPM when we first launched this new payment model back in October of 2019. We have a few folks on the line today who are a little bit newer to this group, and also some folks who are really there with us kind of throughout this journey and helped us to shape that new payment model. But it's been a while. And so I did want to just share a little bit of, if you will bear with the corny jokes for a moment, a little bit of a time machine as we go back to August of 2019, a much different time. And when we launched this program back in August of 2019, there were a few core principles that we really were cleaving to for things that made these new payment models successful. At kind of a philosophical level, making sure that they were flexible, accountable, adequate, and gave us room for adjustment. What that means in practice is really making sure that we've got some processes in place to continually assess how we're doing and adjust that program as we go together to see where it's working and where it's not. Having flexibility for providers to really make sure that those outcomes and are incentivized and that the payment is appropriate for the level of care provided. Making sure that program is adequate so that there are, again, there's really a correspondence between what the cost of the care is to deliver, what the quality of the care is, and the reimbursement that you receive. And having that kind of adjustability to make sure that the payment does, again, meet that level of care needed. So where that philosophy kind of turns into practice, if we also look back to another slide from our August meeting back in 2019, which is now 2 years ago to the month, we had outlined a few next steps for what we would be doing to really support this change and this move to PDPM methodology for skilled nursing stays, both on the Medi-Cal side as well as the Care Advantage side. And so really, so this is a major change. As we kind of outlined at that point, there were trends nationwide that we saw with PDPM reimbursement going up. And so really wanted to kind of both monitor this from a plan perspective and then also look carefully at findings for what we're seeing. And so that's what we've now kind of flashed forward to today. We've now actually had a chance to gather a real year of experience on this program. And you're going to see at the end of today's meeting, actually, some real major takeaways from folks who've done a really fantastic job on access and quality measures in that program, with a big thank you to everyone who's been participating in that. And did want to also share back the results of both kind of that overall review of trends in payment, as well as some of the findings from a recent audit and some policy changes that we're going to be putting in place to support those findings. So what that means, just a real quick snapshot. So what's happened with the per diem reimbursement on the skilled side since we launched this program in October of 2019? I'll just first kind of walk through with the data that we're seeing here and then add a couple of thoughts about the narrative for what we're seeing. This was some data that's been pulled, and I'm just sharing a few insights from our finance team here on kind of what's going on with these numbers. But as we've talked about over the course of our program together, Medi-Cal reimbursement for skilled stays was not something that had an established rate at a state level. Typically, that if a member who had Medi-Cal only qualified for a skilled level of care, that was reimbursed through a per diem with some amount of additional services being reimbursed, or in most cases with HPSM, it was really done through an LOA, which added a lot of administrative burden to both the health plan as well as to facilities to make that work. And the LOAs were often not particularly nuanced in how they were really tied to the level of care that was needed. On the Care Advantage side, reimbursement prior to October 2019 was a little bit more variable facility to facility, but again, was largely for HPSM on a per diem basis and not tied to the typical Medicare methodology. In October of 2019, we made that real change. So moved over to PDPM for skilled stays on the Medi-Cal side, as well as for skilled stays for our Care Advantage dual eligible members. The effect of that was pretty immediate. So we're seeing kind of on the left here, the Medi-Cal reimbursement. That's just our average equivalent per diem that we're spending on skilled stays across the entire network. If we look at that first bar, which is the year prior to October 2019, we see a 35% jump on the Medi-Cal side, quite significant there. And we also see a real jump on the Care Advantage side, so also an increase a lot as soon as that PDPM methodology went into place. If we look a little bit further out then, there were some ongoing increases that we're continuing to see today, although smaller numbers. So on the Medi-Cal side, seeing a 7% and then a 3% increase over the course of that year of 2020. On the Care Advantage side, this is a slightly shorter time period due to the data that we had, but this is again about a little under a 10% increase over the course of 2020. In terms of how we interpret that and what that means, there are a few different pieces of this. So on the one hand, one of the major pain points and challenges that was raised from our facilities during the design of this payment model was that the reimbursement on skilled care was not tied to the resources needed to actually provide that. And PDPM fundamentally changed that structure. So because, as imperfect though it may be, the PDPM structure really does tie that reimbursement to expected resource utilization for a stay. So there's some component of this of really right-sizing the payment for the level of services that were included. There's also a couple of things going on for the things that happened after the PDPM launch. So 2020, of course, being the year of COVID, the average acuity of stays, we don't have definitive data on that yet, but as this group has really experienced firsthand, certainly an exceptional year in terms of the cases being handled. So that's not an entirely unexpected increase there. But just framing all of this to say, in a year in which or in a couple of years in which HPSM has been managing to a negative financial position and really needing to keep a close eye on our finances. This has been a major area of increase for us. And one that we want to just make sure is really, appropriate for the level of care provided. Our goal is always to make sure that we're fairly and appropriately reimbursing for the care that's being provided by facilities. So presenting this as a kind of a context for where we're at, knowing that there are a number of different things behind kind of the numbers that we see here. But separate from just kind of that overall monitoring that the plan did, as we did tee up back in August of 2019, we also started an engagement to do a little bit more auditing of claims to really understand kind of what was going on with costs. So pretty standard procedure for us as a health plan and for most health plans, but worked with a third party to do some audits of utilization, similar to how we review utilization in other areas of care. So looking through kind of from the start of the PDPM payment model through 2020, our auditor reviewed records and assessments of notes to really kind of review what was submitted through claims and what was paid against what was seen in the notes. A number of our facilities here were very helpful in that process and making sure that we had that documentation to review. There were a few key findings here across the cases that were reviewed. The really, one really great thing about what was found here is that initial assessments that came in really did across the board and pretty consistently support the level of acuity that was assigned and what was billed with those HIPS codes when the claim came in. One challenge here was that a number of the reviewed stays didn't show a change in acuity over the course of that skilled stay. And that was a bit unexpected. So that included some longer stays where we would typically expect to see an improvement or a lowering of acuity over the course of the stay for a skilled setting. And then in a number of cases, we were not able to receive documentation of the assessment kind of throughout that stay. So while the initial assessment was there and really did support the level of billing, we weren't always able to obtain the interim and the discharge assessment for the case. So in terms of where we go next with this, just wanted to use today to share kind of a next step from our team's process that we'll be implementing, and flag this if folks have questions or need additional information about this and kind of where we go next. But really just as kind of our next year of the program is now unfolding, we'll be implementing a new requirement to submit all three components of the assessment. So the initial, which again, that's already being submitted quite consistently, which is fantastic. The interim assessments, as well as the discharge assessments. And our hope here, especially with the discharge assessments, which are a CMS requirement today, so we know that those are already being completed with your facility or by your facility staff, but just making sure that we're actually submitting those along with the authorization to support the level of care. That interim assessment, while that is not a Medicare requirement, is one that we will be looking to make sure that that's shared with our health services team to review. Particularly important for us because our Medi-Cal benefit does not have the same days limitations that the Care Advantage benefit has, and so making sure that we're looking closely at that interim assessment there for stays that are not capped at a 60-day benefit is important for us. So again, really the hope here, these assessments are ones that your facility is already completing. Just making sure that we have that data to really support the level of care billed is our next step here. So I'll pause there. Any questions on this one or anything that we can take back for additional feedback for us? Okay, well, we'll take silence as a hopefully an indication that this is all pretty straightforward, but wanted to make sure that we had just communicated this broadly, and we'll share some more about this in writing just across the network too, to make sure that staff are just aware of that change. Next up, so again, wanted to spend a little bit of time today with a very exciting update. We are joined by Marissa Cardelli of our team here at HPSM, who's are leading the charge on the integration of the dental benefit. For HPSM, and we're very excited about what this means for us as a plan, really as a pilot in California. So I want to hand it over to her for a bit of an update, and we'll also be asking a question of everyone in the chat. So really looking to get some feedback from you about dental providers that you are working with today. Marissa, I'm going to go ahead and hand it over to you for our next slide here.
Awesome. Thank you so much, Colleen. So hi, everyone. My name is Marissa Cardarelli, and I'm the Dental Benefits Manager here at HPSM. Today, I wanted to give a quick update on the new dental benefits that will begin for our HPSM members January 1st, 2022, and also discuss some important information that we need from you all to ensure a smooth transition of dental care before we go live. So the background of the dental integration program is that it is a 6-year pilot program authorized by the state, which requires stakeholders' input and includes a formal evaluation of the benefits program. The main goals of the program are to improve access to care for dental services, especially preventative services, and to align oral health with overall health. What this means for our members is that now HPSM will fully manage both their medical and dental benefits. Currently, as you all I'm sure aware, our members have Medi-Cal Dental, or more commonly known as Denti-Cal, and starting January 2022, they will have HPSM dental benefits. This change is going to be automatic and members do not need to do anything to enroll. And we are currently planning before we go live by building our provider network. While this benefits program will benefit members with improved care coordination, providers will also benefit from contracting with us. These benefits include higher payments, less authorizations, and quicker claims payments. What we need from you all is information on the dental providers that your residents are currently seeing in your nursing facilities. It is very important that we have their information so that we can begin the process of credentialing and contracting before 2022. This will ensure continuity of care for members and will also ensure that providers will be paid promptly and at the higher rate for services provided. As Colleen said, if any of you want to add your information of the providers in the chat, that would be great, or we can also send out a follow-up email. Please also feel free to email directly at dental@hpsm or give me a call at the number you see on the slide. Also, I just want to note for the facilities that currently are having a hard time finding dental care for your residents, please do reach out and we can definitely help you start planning for how we can coordinate care starting January 2022. And if any of you want to share the information of the providers now, please put it in the chat or also feel free to ask any questions that you have now. And that is my update for the dental benefits.
And thank you so much, Marissa, for that update. I'm going to just pop back here over so that I can see the chat. And oh, I do see that I missed a question, Jennifer. Sorry about that on the last slide. So we'll make sure to weigh in on that in just a moment. Did want to ask the group though. So to that question of which dental providers you're working with today, I would love to kind of just ask that open-ended question if folks who are in the teams here can pop that into the chat. Or if that is an area where you are actively looking for providers, would love to hear a little bit more about that. So I want to encourage folks to pop something into the chat, and if not, I will just start running down the list and calling on folks because I would love to hear a little bit more about kind of how this works today with your facilities. And I'm going to start just at the top of the list here and pick a couple of folks. So pardon the cold call, but want to just see if we can get a little bit of intel from this group on kind of who you're working with today and how that's going. Starting with Atherton, I don't know, Brad, if you've got thoughts on this one for dental providers that you work with today, or if this is an area of challenge.
I just texted our social services director to see which one we use the most, but I can get back with you in the chat.
Perfect. Appreciate that. And we'll follow up too for thoughts if folks need to connect with their teams on this one, may not have it on hand. I will call a few more folks though, just to see if we can get any thoughts here about San Mateo providers and what's working well or not. Derek, any thoughts on this one? Down from Linda Mar.
Oh yeah, hi, this is Derek. Yeah, I believe our dentist that normally comes out here is from Oral Healthcare. Her name is, it's either her or somebody from there is Zoya Kogan.
Mm. Yeah, Marissa, I'm not sure she's on our radar.
Yeah, great. We have heard the name Oral Healthcare, and we tried to reach out to one contact person, but we're still just waiting to hear back. But that is helpful that you have the name of the provider as well. So thank you.
Sure, no problem.
That's great. Ione, I don't know how much this is maybe more of a coast-side frequent flyer, but any thoughts or anything that's kind of on your radar in terms of dental providers with Seton?
You know what? I just sent Maddie a text to find out who is doing it for us. I don't actually know that answer right at the top of my head, but I have been talking to Stephanie about being one of the first guinea pigs on the new program.
Really exciting. We are very much looking for guinea pigs, and that's wonderful.
So I'm sorry that I don't know the name of the provider, but yeah, it's been interesting though with COVID, yeah?
Yes. Interesting on many fronts. Well, we might that one might be one that the folks need to follow up with their teams on a little bit. But even, just thinking about that one example, it would be so helpful for us to learn more about who you're already working with. We're very much, and Marissa is really leading us here on kind of outreach and getting folks looped in. But sometimes that warm introduction can make all the difference if we're not able to get through to folks, and would really just love to make sure that the folks that you're already working with are on our radar for getting in network. And then Elsa, I saw that you jumped into the chat. Thank you. That's Lumina is another provider there for Brookside. I don't know. Are they a little bit? Are they in the East Bay or is that?
Yeah, they provide service within the whole Bay Area. I have used Oral Healthcare in another buildings before, but Lumina is currently servicing Brookside.
That's great. Great. I don't know, Marissa, if that one's on our radar or not. But.
Yeah. Also, it'd be great if I can reach. If you can give me the name of your contact person at Lumina. I've tried to do a Google search, but I've had a hard time finding that location. So if I can reach out to you in an email, that would be great. Awesome. Thank you so much.
Definitely.
Great. Well, thanks for folks, and I know there are probably a few texts out there pending too. So if folks hear back, please do jump those names in the chat. They're so helpful for us, and really, want to. We're very optimistic we can build a stronger network of dental providers than exists for Denti-Cal in the county today. So thank you for helping us march towards that. Real quick, I saw, Jennifer, you had a question about the requirement for interim assessments. That's going to be prospective, and so for new admissions going forward, we're going to be asking for that. We'll follow up with more detail in a written notification on this one as well, just so that we can make sure that we're clear on all the details of what that looks like and when.
Perfect, thank you.
Thanks. Great. Well,
so, this is Ione. I'll just chime in. Maddie did confirm that we are also using Lumina.
Great, thank you.
Great. That's great to hear, and knowing that they're working with a couple of facilities helps us prioritize, so that's great. Great. Well, feel free to keep dropping those names either in the chat or just chime in with them. But with our last 20 or so minutes here, we might end here early, or I think pretty close to 4:30. Did want to really excited to introduce Kate, who is joining us from our Homebridge program. Stephanie Mahler had sent out some information about this program by email a little bit earlier this summer, but I know we had a lot of interest and wanted to follow up with the full group with an intro with Kate in person, who's joined us today. So Kate, if it's okay, I will hand the microphone over to you to share a little bit more about the program and what you're working on.
Absolutely. Thank you so much, Colleen. Has anyone here heard of Homebridge or is familiar with Homebridge? I know it's a chatty group. So I'll just take it from the top. So Homebridge is a nonprofit organization providing home care to over 1,300 high-risk, complexly diagnosed clients through the county's Medi-Cal funded in-home supportive services entitlement program. And we're also the largest nonprofit employer trainer of home care workers in California. We employ over 300 unionized home care providers. And just again, to give you a little bit more context about our organization, Homebridge providers typically join Homebridge without any formal caregiving training. There's no license or certification requirements through our contract with IHSS. However, as I stated, we're a training employer. And so we provide an intensive 2-week new hire training to all of our providers. And then we also have a formal career ladder program that provides opportunities for additional training and advancement and wage increases. So our highest level of provider is a home care provider level 3. And in that program, providers are trained in paramedical skills needed to meet the needs of our most clinically complex clients. And I give all of this background because what we know and have realized is that there's a great deal of overlap in the skills that our providers are performing with clients and those performed by home health aides and CNAs in other settings. However, prior to now, our training hasn't been formally recognized. So our skilled and experienced providers who are working with some of the most complex individuals, they haven't had a stackable, transferable credential to help them continue to advance in their career. Or frankly, if they move to another city, they have to kind of start from the bottom again because they don't have that credential until now. So what we are really excited to be launching this month, we had hoped to launch a few months ago, but we're now launching this month, a collaboration with the City College of San Francisco to offer a certified nursing assistant training and certification program to some of our most experienced home care providers. And we're following kind of an earn and learn model. It's an on-the-job training. So runs 3 times a year, 6 to 8 providers per cohort. And the theory portion of the training is 12 weeks long and just meets 2 afternoons a week for a total of 10 hours per week. So providers are still able to work full time. And all of their training time and their fees are all paid for by Homebridge. And really our goal through this program is that all participants are going to be given support to pursue careers in healthcare outside of Homebridge through employer partnerships. So, it's bittersweet, but we're essentially trying to give an opportunity to our best caregivers to kind of complete that link in that career ladder and move on and continue to grow outside of Homebridge. And that might sound kind of counterintuitive, but it's our belief that this only strengthens our employer value proposition. And at a time when, as we all know, the staffing shortage, it's incredibly hard to recruit new talent. We hope that by showing that Homebridge is a place that you can come with no skills and get the skills that you need and go on to advance will help us attract new caregivers. So we're launching this month, and at the end of October, we will have 6 newly trained CNAs who will come with an average of 6 years of home care experience, again, with complexly diagnosed individuals going through a pretty robust training that gives them the opportunity to learn skills and apply them with their clients every day. And we are we're here today to talk to you because we are beginning the process of developing relationships with potential employer partners. So individuals like yourselves that may be hiring CNAs and take a look at a program like this and say, yes, we would love to offer an interview to your candidates in October. And really what we're looking for in an employer partnership is someone who, is willing to interview our candidates, but also can give us feedback on how our candidates compare to the other candidates that you're interviewing so that we can continue to figure out how to provide the right supports for our providers as they transition. And then if they're hired, giving us feedback on how they're doing so that we can continue to use those insights to strengthen our training program. So if anyone here is interested in just having a conversation to talk about what an employer partnership could look like, I will share my email in the chat, and I would love for you to reach out. But I'll pause there and see if there's any questions.
I think all of us are going to be interested in this. This is awesome.
Yes.
We're all going to be jumping over this. I mean, I'll be the first one to volunteer or participate or get any information, interview, give you candidates, whatever it takes.
Oh, wonderful. What was your name again?
This is Elsa from Brookside.
Oh, great. I appreciate that, Elsa. Any other questions?
Yeah,
Okay,
so
great.
Elsa may have swooped up some of your first 6 graduates there, Kate, but I think we'll have a lot of folks who are interested in just again thinking a lot about the staffing shortage challenges that so many of our facilities have raised. We were very excited to have Kate tell us about this program and to join us to present today. So thank you, Kate, for putting your contact information there into the chat. We'll also send that out by email to folks after today's call.
Thanks, appreciate it.
Great. Great. Well then, with just a few minutes left before the half-hour mark, did want to share a little bit more as we're continuing this journey with exceptional times with COVID, and certainly as we're seeing our effective number go up, and as the Delta variant is becoming more prevalent. Vaccine hesitancy for our members is very top of mind for us as an organization. We are seeing the same trends that we're seeing nationwide, which is that folks eligible for Medicaid have a pretty big gap in their vaccination rates between the rest of the population. And we're seeing that again nationwide. We're seeing it in California, and we're very much seeing it here in San Mateo County, where we do have an over 20 percentage point gap between our vaccination rates and those of the county overall for folks who are eligible to be vaccinated today. So that has really prompted an ongoing and continued focus here at HPSM as we are working directly with member outreach to really provide information and boost vaccine confidence, but also working with our provider community to provide resources, and really knowing that as providers, your role as a trusted messenger is so incredibly important to helping with vaccine confidence. There's been some really compelling research recently, and I think we're continuing to watch this, and the situation does change, but we are seeing kind of a few major takeaways from some recent polling by the Kaiser Family Foundation, and as well as some statewide polling, and a few takeaways there. So one is that family conversations and provider conversations are really major drivers of boosting that vaccine confidence. A lot of folks who previously had said they were never going to get vaccinated or were going to wait and see, over 20% of them who made a change to actually deciding to go ahead and get vaccinated had that decision impacted by a conversation with a family member, and an even larger percentage from a conversation with a trusted provider. And so really we're focused on trying to make sure that we've kind of helped to disseminate that information where possible, and have put together a few resources that I wanted to just highlight for this group today. And as we go into that, I'm about to go ahead and highlight those, but I did want to just start us off here with a quick poll. And so bear with me for just a moment, but we'd like to hear from folks about whether you are requiring vaccinations for your staff today. And so we're going to try to pop this here into the chat. Again, bear with me with a little bit of an experiment here. And we know that this can be a challenging issue and has a number of components tied to it as we're seeing legislation evolve and precedent evolve, and really just precedent with organizations like the VA and others kind of continue to evolve across the US and here in California. But just we'll do a quick, I say it's quick and then it always takes longer than you think. There we go. Let me know if folks can see a little poll that should have just popped up on your screen there. Is anybody able to see that?
Yes.
No. Yep.
Yep. See it? Okay. Great. You should be able to click on one of the buttons there in the chat, and then hit that submit button, and we can start seeing those come in. Seeing a mix of yeses, nos, and haven't decided. Well, keep sending those in. I think that may help a little bit today, but there's a component of this both with staff, and again, understanding that those conversations and those decisions are certainly complex, and I know we have limited time today, but just getting kind of a feel for where those are is helpful as we really look to this next phase and tracking some of those trends. I know when we met with this group a little earlier this year, we had pretty high vaccination rates of staff across our facilities, a little higher than we were seeing nationwide, where there are still a number of healthcare workers who are not, but know that is an evolving challenge. The resources that I wanted to just point out here with our last few minutes is that we have a couple of links. So one of them you can get to from our main provider page. If you go to hpsm.org and click on provider, you'll see a flag there for COVID resources. And under vaccine resources, we have a few things here that are potentially useful for your facilities that we just wanted to flag. So I'm going to go ahead and try to share this here. One moment. There we go. A couple of things that are actually available for printing out. Can folks see a somewhat colorful web page here?
Yes.
Perfect. Great. Great. So a few things here. We have a couple printouts here. One is just really meant for staff of providers, or providers and your staff. And just, again, pulling from some of those FAQs, using some best practice research and literature on this to just give kind of a quick Q&A for questions that may come up. Again, many of your staff probably have been having these conversations all year and may be able to write the book on them, but we've gotten some feedback from providers that it's been helpful to have some of these questions just printed in kind of a simple format here that can be just printed out and distributed to staff. We also have a couple of resources. One of them is a vaccine safety flyer that can be printed out for your facility, available to families or to patients. And then finally, there is a more in-depth vaccine hesitancy booklet, really focused on kind of helping to build vaccine confidence for folks. This is one that we've actually had a chance to do some field testing with our members on. So really, again, written in accessible language with large text here, and kind of addressing some of those common concerns or questions folks might have that maybe making them feel less confident about the vaccine. There are a lot of other resources at that link that I've shared, so I will share that for folks to peruse a little bit. We have some other kind of messages in terms of kind of talking points. We have a number of resources about vaccine storage and items that may prove helpful to you. There is finally one last resource that I wanted to point out that folks may already be aware of, but there is a well-funded state program called Vaccinate All 58 that has really put together a bunch of materials under the umbrella of I think their campaign is called Take Your Shot. Take the shot. I might have that a little bit off, but they have some really great resources that are free and available to providers and to others to use. They actually have a number of brochures that you can just request for free and there's an order form for that I will also send out in follow-up to today's conversation. And there's a little bit more of an in-depth discussion. It's an hour-long webinar that they offered with a couple of clinicians talking about just some of the real brass tacks of how to have those crucial conversations about COVID-19, particularly in cases where folks may be feeling some burnout from these, or kind of how to answer some of the newer questions about the Delta variant and what that means for folks. I'll pause briefly there. We will be sending those resources out in follow-up, but any questions from the group or thoughts on how that's going? Okay. Well, again, if there are more resources that HPSM can be providing or connecting the dots on this, we want to just really support you in this continued fight against COVID and really this next phase of that fight as we are seeing case numbers creep back up and needs for placement creep back up, knowing that the vaccine is our best defense there, and just really want to make sure we're providing helpful resources for you to make that a little bit easier. As we close today, so just again, coming right up against the hour, but I did want to loop back to our theme of the Olympics and just pause for a moment of recognition and gratitude. So as you know, we shared in prior meetings on some of those major findings of the first year of the quality payment program. We had some kind of exciting news there in terms of folks who really flourished under this program on both quality and access measures. And so just with a little bit of our theme here of the Olympics, just wanted to call out some folks who really went for the gold. On those measures within the new payment program related to access and to quality, keeping in mind that those access measures play a very significant role in this program, and that those quality measures are also very much tied to kind of where we go next with this reimbursement. Wanted to really call out 4 facilities in particular in that very first year of the program for fantastic performance, both for long-term care as well as for skilled nursing. Again, both components of that program. So St. Francis Pavilion, SMMC, BSS, and BSN. Providence San Bruno, and also Seton Coastside. So I know we've got some folks from those facilities here today. As we dive into some of those quality ratings in our future meetings, and as we're looking at kind of more of that live data for what we're seeing today, we will be doing a deeper dive into some of those quality measures, and particularly looking to really hear from folks on kind of what's been working well, how the work around Live Well that we worked on together over the past couple of years has been applied, and where we can do a little bit of just pure learning on what's working well to drive that performance. So just wanted to pause and extend some gratitude and congratulations to our folks who really had across the board some really strong performance on access and quality for long-term care and for skilled nursing. But finally, yeah, I heard a yay. We need more of it, I think. And just a big thank you. But just also really, again, a huge thank you and congratulations to folks on this call and to all of our nursing facilities here in San Mateo County participating in this program. We really do truly believe this is something unique in this community, and the ability to partner with you all to both design this program and help work together to raise the bar on quality is certainly inspiring for me personally, and just we're very grateful as an organization to get to work with you on this journey. So I'm going to close with a round of virtual applause. And thank everyone for joining us this afternoon. We will send out the materials from today's presentation. If you had any questions or thoughts that were sitting in the back of your mind and you didn't have a chance to ask them in such a large group, please do reach out. Feel free to send an email to myself, to Stephanie Mahler, and certainly to reach out to Kate about the fantastic new workforce program that she's helping to champion here in San Mateo County.
Thank you.
Thanks all. Take care and be well.